All right. Good morning, good afternoon, good evening, whatever time it is you're watching this. Yes, we have a special guest today. We'll get to that in just a minute. But so, what did you do this week? What did you do fun? This weekend, we'll start backwards. So this weekend we did the Tea Fest. So I worked the Tea Fest this weekend, had a lot of fun with that. And then earlier this week we found out that somebody is in remission from his kidney disease. So yay, no more kidney disease. We did his blood work. His creatinine was 1.4. As most of you know, creatinine normal levels are 1.5. And so in February it was 1.6. So we're at 1.4. So it's so exciting. We did a whole mixture of integrative medicine. So veterinary medicine, Western medicine, with some Eastern medicine. So acupuncture that turned into like laser acupuncture, where they use the laser on the acupressure points instead of doing the needles. So we transitioned into that. And then sound frequency therapy with some energy healing therapy. So yes, a whole mixture of integrative medicine here. So keep it up. So yes, that's exciting. Last week we talked about the difference between burnout and compassion fatigue. And so this week we're going to take a deeper dive, but I have my husband here, Dr. John Ellison. He's been in emergency medicine for over 20 years. So about 22 years now?
22,
yeah. So he's going to talk about how he recognizes like his compassion fatigue and burnout in himself. And then we're going to see how symptoms and signs that he sees in colleagues and how he recognizes in them, because sometimes people looking from the outside can recognize it quicker than you can yourself. So first of all, burnout. So when you're at work, how do you recognize when you're starting to feel burnout?
I think for me, it's always been a consistent degree of mental, emotional, and physical fatigue concurrently. And it often manifests as not wanting to go into work and not wanting to deal with the realities of work. For me, it's never manifested as not wanting to treat the patients or interacting with pet parents. But I've always recognized that I need a break when I consistently feel concurrently mentally, physically, and emotionally fatigued. And oftentimes taking that break really helps to resolve those feelings and that degree of burnout. And for me in the past, that's often entailed needing to take a more extended break, meaning not just a few days off, but to take a week or sometimes a extended sabbatical as I did once in the past. And that has fairly consistently allowed me to renew how I feel and reinvigorate an enthusiasm for emergency medicine specifically. But with that said, I think in colleagues where I've seen that they've reached a consistent point of burnout and haven't been able to bring themselves back to a point where they feel enthusiastic and renewed, sometimes, unfortunately, it's a matter of either making a sub-career change, meaning if you're in emergency medicine, going into general practice, or even getting out of clinical medicine. And I don't think anyone should feel that there's anything wrong with making that change, and they certainly shouldn't feel like they're a failure on any level, whether that's a doctor or a technician or an assistant.
And then when you're taking a break, as much as you enjoy treating the animals, and I feel like even someone when they're burned out, you miss treating the animals, correct? Like when you were even when you were taking that sabbatical, you still, you were burned out, and the thought of doing medicine at that time didn't appeal to you, but being around the animals and helping them, you did miss that, right?
Yeah, I did. But I think that, and I enjoyed after my sabbatical going back and treating patients and directly in a face-to-face nature interacting with pet parents. But I think that there also are ways to accomplish one's need and desire, which we all have in veterinary medicine, to treat patients in a way that's still conducive to that particular professional's mental and physical health. And for me, right now, I'm doing 100% of the time telemedicine, and it's really been for me a great avenue to still be able to treat patients, which I do feel like I'm able to do, especially those patients who may not be able to get care because they're in care deserts, as we call it, meaning without access, at least not readily available access geographically or in terms of time to veterinary care. And also to be able to help pet parents who may be not able to physically bring their animal to a veterinarian. And for me, that's allowed me, as much as I enjoy and have enjoyed, treating critical patients, especially in an ICU setting, it's allowed me to take a step back from that after effectively 22 years of doing that, because it has and it does take an emotional fatigue. And I got to the point of acknowledging that. And when I acknowledged that and didn't feel like a failure for feeling that way, then that allowed me to open myself up to other avenues, specifically telemedicine right now. And I think that no one in veterinary medicine, if you just don't have the passion for doing clinical medicine anymore, whether that's a result of burnout or compassion fatigue, should feel empowered to find another avenue within the profession, because there are so many different things that any professional can do in our profession in general. And it's one of the many things that I love about veterinary medicine.
I'm gonna go back for a minute, and you're talking about when you take extended time off. So, one of the things that we've worked on is creating a schedule that works for you, that allows you to give you that time off or that break in between your shifts, and be able to kind of what I call debriefing and resting, and then kind of preparing to go back. So my question to you is, what during that time off, what do you do? Like, what do you do to help you kind of debrief and to rest and get ready to go back to your job?
I think in relation to that, consistency of scheduling is so important, especially in ER, meaning to be able to have, as Brandy alluded to, consistent time off, meaning if you're working a strict overnight schedule or even a strict late swing schedule where your shifts in an overnight situation end at 8 a.m., given the following morning, or with the swing when they end at midnight or 2 a.m., to be able to work some variant of a week on, week off schedule where you can have extended time off to be able to recover. And I think, for me, during my recovery time, I guess as juvenile as it may sound to some people, I've always enjoyed playing computer games. And, that to me really helps to take my mind away from the stress of our profession and the mental vigor, because with the exception of a few things, I don't really have to think about anything. And I enjoy spending time with Brandy and Bentley and getting outside, especially with where we are right now in Oregon, and being able to hike and even just travel locally and do some things that are fun, that takes my mind off of the stress of the job. But those those things that allow any given person to debrief and recover are so variable from person to person. And, even if all that you want to do on your days off is sit there and stare at the wall and, or stare at the TV or, read books, that's fine. You shouldn't feel guilty about doing that. And, me as an introvert, I often I spend so much time, whether it's in clinical medicine, especially interacting with people, less so in telemedicine, but I still do, and I enjoy that interaction with pet parents and my colleagues. But as an introvert, and I think all of you introverts out there can empathize that it becomes very almost mentally overwhelming in terms of the amount of stimuli you get. So for me, as much as I love spending time with Brandy and Bentley, and I do enjoy, to a limited extent, being out in public as long as it's not too busy, being having that time to yourself, especially as an introvert, is important. To the contrary, if you're an extrovert and you want to go out to a social event on your days off, that's fine. I think in veterinary medicine, a corollary to that is we have such pressure to work harder and harder and harder. And I think we're told by managers and others that the solution to overwork is just to work more. And there are a variety of mantras that I think some, not all, managers use in relation to that. And I've heard it myself, or blaming that person who's feeling overworked for just not having appropriate mental fortitude, and sometimes even saying directly to them that maybe this profession isn't for you, or maybe this job isn't for you, instead of, and this is what the very good managers that I've had have said, is then let's find a schedule that works for you. Let's find a set of job parameters or a job that works for you. And I think that in general in veterinary medicine, we need to become more focused on that instead of just fitting everyone into a single mold within a given role within a given hospital. And I think that's tangentially a lot of the problem with clinical medicine is there's just a degree of inflexibility about how one can work. And for me in telemedicine, I really found an avenue where I can define my own schedule with the company that I'm at now. And I've really enjoyed that. And I've really enjoyed working for this company because they're very flexible in that way. So.
And, and for spouses and loved ones, we work very hard with working our schedules and what works best for him. And for us, and I say that we've helped find a schedule that works out for him at work. I've helped him with that. I'm really good with scheduling and everything, so we've done that. I also, even here at home, so we've been together for so long. I know him so well in a sense. Like, I understand he needs his alone time. I need my alone time too, and how. Excuse me, and how we worked our schedules around, like we were able to provide that for each other, with no offense taken whatsoever. And and sometimes it's funny because even though our offices are in one room, like we'll have our alone time together and not bother each other because we're so focused and zoned in with everything. And gaming is a big thing. There's a lot of people that make money in gaming, so no shaming on anybody who does gaming, okay? There's nothing juvenile by that, by no means. But also too, honestly, like with everything that's going on in your field and with people having thoughts they shouldn't have and doing things that they shouldn't be doing in a sense to themselves, like I much rather him be gaming than having those thoughts. I much rather him, if he wants to go outside forest bathing naked or whatever, if that prevents him from having those thoughts, like go for it. Like, I don't care. I just don't, and that's how I feel about every one of you. So don't, whatever works best for you, you need to figure that out and don't be ashamed to do it as well. So let's go to, how do you, like when you're working and you see your colleagues and other people and coworkers, how do you recognize burnout? Because a lot of times people, they get burned out and they don't see it themselves. As I had an employee, like I knew she was working 2 jobs. She was working full time with me, and then she was also working another part time job. And I could start seeing in her the signs of burnout because I recognized them from you and what you went through. And so when you're at work, how do you recognize signs of burnout from coworkers and colleagues?
I think it's really a matter of knowing that person, how they operate in a normal kind of basal, non-burned out state. And when they digress from that state, meaning demonstrate less enthusiasm, when they seem, for instance, with technicians, when they seem less enthusiastic and almost providing pushback, even if that's just a shrug of the shoulders or oh, okay, I'm happy to do that, instead of saying that, them saying, I just not demonstrating the same degree of enthusiasm. I think that, to me, that's a hallmark sign of burnout. And with a lot of doctors, and I've been through it myself, and I've regretfully demonstrated the same, just not wanting to see cases, or being slower in seeing cases, or feeling like it's a burden to take on those cases instead of wanting to see them because you want to treat those patients, and which we do on every level, from doctors to technicians to assistants. And I think that when I see that in a colleague, I consistently ask them, hey, Bob, I haven't worked with the Bob, so that's just a generic name, but, hey, Bob, are you feeling okay? Or hey, Bobette, are you feeling okay? Do you want to talk about anything? And sometimes, and oftentimes they do. And, if it's a specific case that was very difficult, or a specific shift that was very difficult, I think having a sit down conversation with them can really help, because sometimes all they need to do, and I've experienced this before, is to be able to vent, which basically means to be able to emotionally kind of unload that burden off of yourself. And especially if they don't have a spouse or a significant other who's as understanding and as willing to listen as Brandy is, or if they don't have a significant other, having that other person, whoever it is, to be able to talk to can really be helpful. And I think the other key, because we are taught, I think often wrongfully, to just grin and bear it and to suppress our emotions in veterinary medicine and in medicine in general. I think sometimes you have to recognize those traits in terms of even just a worse posture, or moving slower, or looking sad, or looking stressed, and a colleague, and then be able to intervene and see if they want to talk about things. And more often than not, they do. And, if you can't help, then providing resources that can help. And, I've worked at a large hospital that had a emotional, or a grief counselor, not a grief counselor, but a emotional support counselor. And, I think she really helped because she was there, at this large hospital, to help us talk through things. And I think having that point person, even if it's the direct department manager, can really be helpful. And sometimes it's just a matter of pulling that person aside, especially if you're a manager, and saying, hey, let's talk through this before your next shift, so we can figure out a route to helping you feel better. And again, even if that's taking time off, there's nothing wrong with that. Even if that's changing to a different sub-profession within the profession, or changing the profession altogether, there's absolutely nothing wrong with that.
And, I think the key there is like, and what makes it challenging is you yourself have to, like, if you're feeling burnout and need to talk to someone, like having to pull that person. And, I loved that hospital had that person there, but as I've always said, I feel like that person, it should have been part of your contract and everyone's contract to make sure they spoke to this person once a quarter, or make it a routine, part of a routine and mandatory for you to have, go and talk to this person. I do truly think they should have done that, in a sense, because then she could have a good baseline where that person is sitting, and definitely if someone's starting to, have compassion fatigue, which we'll talk about that, because compassion fatigue sometimes is harder to pick up and catch on than burnout is within yourself. Have you, I don't think you've ever really experienced compassion fatigue per se.
I don't really know that I have, but I've definitely seen it in other colleagues, and that often can manifest as getting more judgmental towards pet parents, or even for technicians towards animals, and not having the patience for them that we should in both situations, knowing that they're both in stressful situations. And obviously there's never an excuse for a pet parent being verbally abusive. Like, that should never be tolerated in veterinary human medicine. But sometimes I've seen colleagues on every level, from assistants to technicians to doctors, to say that, well, that pet parent is, I don't want to deal with that person, or they're being stupid or unreasonable. And sometimes all that they need is someone to listen to them, and specifically someone to know that their concerns are not invalid, that their concerns are warranted. And I would argue that in nearly 100% of the cases, their concerns are, because they truly do know their pet the best. And Brandy and I were talking the other day about situations that I've been in, where even though I had a million other things to do, I've taken the time to listen to pet parents, even if it's a very circuitous route for them to get to the pertinent information. And oftentimes that yielded information that was really helpful to me to be able to treat that animal. So I think that, seeing that in a person or a colleague is really important to identify compassion fatigue. And there certainly are those colleagues that, as a baseline, will just complain about, especially pet parents. But I think when you have a colleague who isn't like that at baseline, and then they become that way, I think that often indicates that they need a break. And I've seen that with several different people. And sometimes it's a matter of changing from overnights to days. And I saw that with an overnight technician I worked with for years, where she just needed to change from working from overnights to days, because physiologically and psychologically she just didn't do well working overnights.
And would you recommend, like, I would say if you walked into a new situation, like, you were the new person at a clinic and someone was being that way, would it be appropriate to say, hey, has this person always been like this? Is this normal for this person? And, and if another coworker there said, no, they haven't been like that, or, it just started, or it's been like that for a while, but it used to not be like that. Do you think that's something that would be appropriate? And then also understanding that, okay, that person could either be, starting to be burned out or compassion fatigue.
Yeah, I think it would be appropriate to question that, and that also gets to the root of how a clinic atmosphere should be set up, and that also then goes to the management to be able to establish a clinic atmosphere where there's very limited to zero tolerance about um, certainly about complaining about the patients in that hospital, even if they're being aggressive. And there has to be a limit on complaining about pet parents, especially on the clinic floor. I think doing that individually to a colleague is different, and because that gets back to being able to vent frustrations. But if a employee is continuously venting to members or talking to members on to other staff members on the floor about how this pet parent this and that pet parent that, then I think that employee really needs to be um, spoken to and find out if that is rooted in compassion fatigue or other emotional issues, to try to help that person. And if it's just something that doesn't change, then obviously different decisions need to be made with that employee. But I think most people, when you talk to them and ask them, you feeling burned out, are you do you have these triggers of compassion fatigue or burnout? Do you have enthusiasm for coming to work, or do you hate coming to work, or do you dread each case that comes in? And if they answer yes to those questions in a negative way, then you know I think there are things that can be changed as far as those as far as correcting how those employees perceive pet parents and pets.
You said something important, um, where I know this is a discussion we've had a while back, but you were talking about pet parents being, they should never be verbally abusive, but also like understanding the difference between someone coming in that is terrified and upset with what's going on with their animals, and it projects as what some people may interpret as verbal abuse, but it really isn't. So how do you, in those situations, how do you as a doctor determine that it's not verbal abuse, that this owner or this pet parent is literally just terrified with what's going on? Because one, they don't have the knowledge that you do as a doctor, but two, like, for a lot of us, like, this is our child. Because I mean, if I didn't have the knowledge that I have, like, from with you, then I would be terrified. And with some of the things that goes on with him, or even from being in emergency medicine, like some of the people that do, seeing some of the cases, again, if I didn't have the knowledge that I had, like, I would be just as terrified, if not more terrified, than some of these pet parents are. So how do you determine the difference between that?
I think for me, it's being able to read people's body language and their general mannerisms. Like, for instance, if someone is being more abrupt because they're upset and worried, absolutely understand about what's going on with their pet, you can see that distress on them in terms of them being physically restless, in terms of sometimes them physically shaking or crying. Um, and I think if you see that, even if they're um, abrupt, for instance, if you ask them to determine an emergency CPR directive, if that patient needs to be intubated or if that patient needs CPR, and they say, well, of course I want him resuscitated, just, do that. I try not to take that as them being verbally abusive, but just literally saying, of course, that's what I want. And in that emotional moment, that's how it comes out. And to be fair, God forbid if that happened with Bentley, I think that Brandy and I probably wouldn't be very calm about it. and we may come off as being abrupt. I think the difference for me is when I can see that someone is ostensibly calm and when they don't appear emotionally distressed, but if they're just being pushy or difficult, is when I think that understandably, employees, and I've been in this situation too, have a right to get upset and even say, hey, we really need you to be more respectful to the staff so that we can be able to be in an appropriate emotional state ourselves to be able to treat your animal, because that's our focus. And sometimes I've had to tell people, like, we are doing the best we can to treat your animal with our current circumstances. So please be patient with us, and please know that our interest is in treating your animal. It's not about getting money. It's not about, we're not in back having Mai Tais. We're dealing with a myriad number of things. So please be patient with us and please be kind to us. And I think that's often how I differentiate between those two circumstances.
Yeah, it's interesting. You were talking about us with Bentley. Even you're right. I always said in an emergency situation, your doctor instincts would take over, your emergency doctor instincts, and we've seen that. We've seen that with our husky Kaya, and it's interesting because most recently I noticed you've always talked about how you really didn't like to do open chest compressions, even though you always offer that as an option. That was one of the things. But I also noticed recently with Bentley, when we had the hospital, like you opted for that if it needed that, and it kind of took me aback, and I was a little bit surprised with that you decided that to do that, as much as that's something you don't like to do yourself. So yes, I say that in a sense with understanding that if we were ever in that situation with Bentley, I don't think we would be calm. And I'm definitely that person. Like, you're going to treat I want all animals to be treated appropriately and to the best of the ability. But I will be the first one to be that patient, be that pet parent. I will say that, yes. But also with that, my advice, especially to people managing these lovely people, let me tell you, people who do veterinary work are superhuman people to me, because anybody who helps animals and works on animals, has a special place in my heart, because I would love to have the ability to be able to do what you do. Like, it's amazing. So my advice to managers is, these people are not dime a dozen. Your veterinarians, your technicians, they're not a dime a dozen. You can train a CSR. You got to be able to train them appropriately. There's more people out there with guest servicing skills and can be nice to all that. That's easy to do. Sorry, CSRs, but that's the truth. But as far as your technicians, your assistants, and your veterinarians, like, they're not a dime a dozen. You are short staffed in this industry, and stats are you're going to be short staffed for at least 30 years. Okay. You can build all the schools you want to, you can expand the classes. It's going to take that long, because these people, they need the knowledge. The only way you could even possibly shorten that is treat your employees with respect. Watch them, listen to them. You got to retain your employees, okay? But my advice is, listen, watch for the signs of burnout, talk to them, listen to them, work with them. One of the best clinics that he worked at when it came to scheduling, the schedule person, she gave everybody the schedule that they wanted. And it worked out perfectly. And this was a 24-hour clinic. Like, all the shifts were covered, everything was covered. She may have to do a couple of plugins here and there, but when everybody got everything they wanted, all the shifts were covered 24 hours. It was amazing. And she was amazing to work with. And so when they put her in a different position, she was one of the straws that broke the camel's back for a few of the doctors to leave that clinic, because the scheduling person after that was not the best. So that's my advice. My other advice is for veterinarians, technicians, assistants in this field, find what works best for you. Take care of you so you can work through and help prevent this burnout and compassion fatigue. Recognize the signs. If you see it in colleagues, coworkers, say something. Pull them aside. Take them out somewhere and chat with them. Do something to help, or get someone to help them if you can't do that yourself. There are a lot more resources out there today than there was back when, Sean and I met, and, through Sean's time in emergency veterinarian, in the field. So, I mean, there's a lot of people who have been in the field, and they've expanded off to helping people in the veterinary field to work through burnout, life coach, everything they need to do. A lot of resources out there, a lot more than there were before. So definitely utilize them. So that would be my advice to you. Sean, what would be and spouses, loved ones, keep an eye on them, help them, support them, understand they're going through a lot. Everybody from like your GPs to your specialty, their specialists, to your emergencies, even though I say emergency is also its own specialty as well, because not everybody can do emergency medicine, and not every emergency doctor can do GP. It's, but work with them, listen to them, find out what works for them. How can you help them? How can you support them? And work around that, because you know what? When the tables are turned, you would want the same thing, right? That same understanding, that same compassion, that same support. So provide that for them. Ask them, hey, how can I support you? If you have to. So then my question to you is, one, what is your advice to spouses and loved ones, or including friends? What is your advice to colleagues, and what is your advice to managers as far as, people that are going through burnout and compassion fatigue?
I think for spouses, it's a matter of recognizing when your loved one who's in veterinary medicine has an alteration from their baseline. And if you notice signs of depression, or them seeming just very much less energetic beyond just physical fatigue, then I think you should intervene in a way that you feel is appropriate. And then for colleagues, I think similarly, pulling that person aside, even if it's an employee whom you don't know well, and offering to talk, and also offering advice as far as ways that have worked for you, whatever ways those are, to be able to decompress and to be able to have an exodus from burnout and compassion fatigue. And I think for managers, again, it's a matter of figuring out how not to be so cookie cutter in your approach, and realize that every employee is literally an individual, and they have different scheduling needs and desires, and there are very, very few people, I would say less than 1% of the people whom I've worked with in medicine, that are just lazy and who don't want to work. But a lot of those people may need to only work 3 days a week, or there's some people who want to work 5 days a week. There's some people who want to work, every other Monday, and every 14th, 4th of July. And if that works for them, then I really think that we, at this point in veterinary medicine, as managers, not me inclusively, because I'm not a manager except of myself, but I don't know that I do that well. Brandy is a better manager of me than I am. But I think that the managers just need to be able to accommodate individual schedules and needs, and I think in terms of general hospital operations, whether it's record keeping or how long someone takes to see cases, as long as their medicine is appropriate and they're doing what's appropriate for that patient and those patients, nothing else really matters. I mean, as long as they're coming to work the shifts, as long as they see all the cases, and as long as they're treating all of those patients to the best of their ability and doing appropriate medicine, to me, it doesn't matter how long their medical records are. It doesn't matter what they include in the medical records, as long as it's appropriate veterinary information. And it doesn't matter how long they take speaking to pet parents, as long as the pet parents are accepting of the treatment plan and the recommendations, as long as that veterinarian is in that profession, that veterinary professional is empathetic, is thorough, and takes the time to answer all those pet parents' questions. And if every employee accomplishes those things, then management should allow each employee to operate within that small set of defined fundamental parameters, however they want to operate. And I think that if we continue, because I've seen it at several clinics, get to the point where we dismiss employees, even though they're treating patients appropriately, their medical records are good, and pet parents are satisfied with their interactions with that employee or veterinarian, that employee is let go because they can't meet a certain number of case metrics, or they're asked to change a job or change the way that they practice. I don't think we're going to be successful, because we have to accommodate, and managers absolutely have to accommodate individual employee needs. And when that's done, and when they honor an individual employee's abilities and expand on those, that's where that, not only that employee, but then that department and then that hospital becomes successful.
All right. And with that, we will let you go. Thank you for listening. Thank you for watching. And remember, if you have NOMV, Not One More Vet, Lifeboat, so that's the peer-to-peer, if you need someone to talk to. So you talk to someone kind of similar to Sean, as we're sitting here, talking about having that person to talk to that understands what you're going through. So that has like a 48-hour turnaround time. So keep that in mind. With NOMV, it's free. Then you have, if you're having thoughts and need to talk to someone immediately, you can call or text 988, or you can text home to 741-741. All right. So until next week, enjoy, have fun, do something for yourself. All right. And remember, we got good kidneys. Yay. All right, guys. Thank you.